Good morning, you guys. It is time for your health check. And I don't have to tell you, working from home certainly has its perks. I'm quite enjoying it. But it can also create some unhealthy habits. For instance, snacking all day long, right? In fact, doctors have noticed an increase in the amount of weight that people are gaining. And it all makes sense. Here's the deal. We're home, we're feeling stressed or bored or lonely. And this can increase in what's called emotional eating, stress eating, a lot of mindless snacking. And that's why it's important to practice what's called mindful eating.
A lot of people use their desk as a dining room table. Instead, think location, location, location. Pick a snack spot. And when you have a snack, it's fine to have a snack. Just stop what you're doing, move to that spot, and that's where you have your snack.
Okay, well, my entire apartment is my snack spot, so I'm gonna make some adjustments there. You should also sit down while you eat, by the way. Studies show that people eat 5% less when they're sitting at an actual table. Remember to chew slowly, take your time, savor each bite, and finally, stop what you're doing. It might be easier while you work, but really, that should be avoided. Don't work and eat at the same time. Okay, apparently, nearly 40% of Americans still don't feel safe going to the doctor during this pandemic. This is interesting. This comes from a new study from the Society for Cardiovascular Angiography and Intervention. So here's the deal on this one. This study found that more than 30% of Americans have not had a routine checkup in the last year. More than half still don't feel comfortable scheduling any medical procedure. And listen to this, only 33% of Black and African American and 34% of Latinx community folks who responded would be comfortable going to the hospital for an emergency while COVID-19 is still at risk. For an emergency, okay? Here's another interesting stat that came from this survey. It found that more people are afraid of contracting COVID than even having a heart attack or stroke. All right, you guys, well, overall wellness, I talk about this all the time, is an important part of staying healthy. So if you are hoping to get 2021 off to a strong start, or maybe you just need a little reset button, join my Fitter Together Facebook group. I'm leading a 12-month program called the Self-Care Solution. And this month is all about cutting out alcohol. So it's been all dry January. We're almost done, though. It's not too late to join in. Look up our group on Facebook. I've got it twinned to the top of my Facebook page. And Mark, February is planks and push-ups. I know that you did not participate in dry January, so I know that you will be all about planks and push-ups in February.
In. I'm 100% in. I can't wait. I'm looking forward to it. Have it marked on the calendar.
Everybody heard you.
Yes.
There's no going back.
Hold me accountable.
Okay.
All right. Thanks, Sonia.